Hello dears, in this video I will discuss MCQs in general surgery. 1. A 65-year-old male presents with dysphagia and significant weight loss. An endoscopy reveals a localized esophageal tumor. Biopsy confirms T1a disease, but the pretreatment distinction between T1a and T1b is uncertain. What is the most prudent next step in management? A. Chemoradiotherapy. B. Endoscopic resection. C. Immediate oesophagectomy. D. Observation and follow-up. E. Palliative care. Answer is B. 2. A 58-year-old female undergoes endoscopic resection for an esophageal tumor. The resected specimen shows T1a disease with clear margins and no lymphovascular permeation. What is the next step in her treatment plan? A. Adjuvant chemotherapy. B. Additional endoscopic surveillance. C. No further treatment needed. D. Radiotherapy. E. Repeat endoscopic resection. Answer is C. 3. A patient with a localized esophageal tumor is being evaluated for surgery. The tumor is confined to the esophageal wall with no evidence of distant metastasis. What is the primary goal of surgical resection in this patient? A. Palliation of symptoms. B. Complete removal of the tumor with clear margins. C. Minimizing hospital stay. D. Performing a partial oesophagectomy. E. Reducing the size of the tumor before chemotherapy. Answer is B. 4. A 70-year-old male with T1a and T1b esophageal cancer is being prepared for surgery. What multimodal treatment approach is most appropriate for this advanced stage of disease? A. Surgery alone. B. Chemotherapy alone. C. Chemoradiotherapy followed by surgery. D. Endoscopic resection. E. Observation and follow-up. Answer is C. 5. A patient with esophageal cancer undergoes a Lewis-Tanner procedure. What does this surgical approach involve? A. Cervical and abdominal incisions with gastric pull-up. B. Left thoracoabdominal incision. C. Right thoracotomy and laparotomy. D. Transhiatal esophagectomy with blunt dissection. E. Minimally invasive esophagectomy. Answer is C. 6. A 62-year-old patient is undergoing preoperative assessment for esophagectomy. Which of the following is an essential component of preoperative preparation? A. Bowel preparation. B. Continuation of smoking. C. Enhanced recovery after surgery, ERAS, protocols. D. No nutritional support. E. Prolonged fasting. Answer is C. 7. A 55-year-old male with a history of heavy smoking and alcohol use presents with a newly diagnosed esophageal cancer. In preparation for surgery, which of the following is not recommended? A. Chest physiotherapy. B. Incentive spirometry. C. Prolonged fasting. D. Smoking cessation. E. Nutritional support. Answer is C. 8. A patient with advanced esophageal cancer is considered for palliation. What is the primary goal of palliative care in this context? A. Achieving R0 resection. B. Immediate relief of dysphagia. C. Long-term disease control. D. Prolonged hospital stay. E. Surgical resection. Answer is B. 9. A 65-year-old man presents with progressive difficulty swallowing solid foods, which has now progressed to liquids. He has a significant history of smoking and alcohol consumption. 1. What is the most likely type of esophageal cancer in this patient? A. Adenocarcinoma. B. Squamous cell carcinoma. C. Small cell carcinoma. D. Melanoma. E. Metastatic carcinoma. Answer is B. 10. A 50-year-old woman, with a history of chronic gastroesophageal reflux disease, GORD, presence with worsening heartburn and difficulty swallowing. She has a BMI of 32. Which type of esophageal cancer is she most at risk of developing? A squamous cell carcinoma. B adenocarcinoma. C small cell carcinoma. D melanoma. E secondary carcinoma. Answer is B. 11. A 70-year-old man from East Asia, who experiences facial flushing when consuming alcohol, presence with progressive dysphagia and significant weight loss. What genetic predisposition may contribute to his risk of esophageal cancer? A ALDH2 deficiency. B BRCA1 mutation. C APC gene mutation. D HER2 overexpression. E P53 mutation. Answer is A. 12. A 60-year-old man with a history of smoking and alcohol use presents with dysphagia and a 10 kg weight loss over the past 3 months. An endoscopy reveals a mass in the middle third of the esophagus. Which histological type of cancer is most likely present in this patient? A adenocarcinoma. B squamous cell carcinoma. C small cell carcinoma. D melanoma. E secondary carcinoma. Answer is B. 13. A 55-year-old obese male with a history of Barrett's esophagus presents for a routine endoscopy. No symptoms are reported. What is the significance of performing an endoscopy in this patient? A. To assess for dysplastic changes. B. To perform immediate surgical resection. C. To administer photodynamic therapy. D. To initiate chemotherapy. E. To conduct barium contrast studies. Answer is A. 14. A 45-year-old woman presents with a 5-year history of dysphagia for both solids and liquids, regurgitation, and significant weight loss. Endoscopy reveals a dilated esophagus with food residue and a tight lower esophageal sphincter, LOS. Barium swallow shows a bird's beak appearance. 15. Which of the following is the most likely diagnosis? A gastroesophageal reflux disease, GERDB. B esophageal cancer. C achalasia. D peptic ulcer disease. E Barrett's esophagus. Answer is C. 16. A 60-year-old man presents with chronic dysphagia, regurgitation of undigested food, and halitosis. An endoscopy reveals frothy saliva pooling in the esophagus and food residue. A barium contrast study shows a tapering stricture in the distal esophagus. Which diagnostic test is definitive for confirming the diagnosis of achalasia? A barium swallow. B high-resolution manometry, HRM. C endoscopy. D chest X-ray. E CT scan. Answer is B. 17. A 35-year-old man diagnosed with achalasia is considering treatment options. He is concerned about potential side effects and long-term outcomes. His physician mentions that a certain treatment has a risk of GERD and suggests combining it with partial fundoplication. Which treatment is being described? A pneumatic dilatation. B botulinum toxin injection. C Heller's myotomy. D periral endoscopic myotomy, POEME. E medical therapy with calcium channel blockers. Answer is C. 18. A 70-year-old woman with comorbidities presents with achalasia and is considered a poor candidate for surgery. The physician recommends a temporary treatment that involves injecting a substance into the loss to paralyze the sphincter muscle. Which treatment is being described? A pneumatic dilatation. B botulinum toxin injection. C Heller's myotomy. D periral endoscopic myotomy, POEME. E. Medical therapy with nitrates. Answer is B. 19. A 50-year-old female patient with achalasia undergoes a procedure that involves stretching the loss with a balloon. She experiences relief, but her doctor warns her about a risk associated with larger balloons. What is the primary risk associated with this procedure? A. GERD. B. infection. C. perforation. D. residual dysphagia. E. scarring. Answer is C. 20. A 55-year-old man with advanced achalasia has a severely dilated and tortuous esophagus with significant food stasis. He has frequent episodes of aspiration pneumonia. Despite various treatments, his symptoms persist. What is the next most appropriate management option for this patient? A. Continued medical therapy with nitrates. B. Repeat botulinum toxin injections. C. Serial pneumatic dilatation. D. Heller's myotomy. E. Oesophagectomy. Answer is E.